Hello, and welcome to Med Evidence Articles, where we encourage community research and education with weekly articles. I'm your host, Benton Loeyball, and this week we're talking about a link between mouthwash and high blood pressure. What does mouthwash have to do with high blood pressure? Have you ever wanted to see some human bones sticking out of the skin? Well, me neither, but did you know that you do see this sight each and every time you brush your teeth? Teeth are pretty awesome. They help us chew, eat, talk, and make that super loud whistle that some people can do. Nah, that's not it. Having our teeth bones exposed to the warm, wet, nutrient-rich place we call our mouths can present some issues, however, especially for those of us who consider a half-gallon of ice cream to be just 2 servings. The mouth hosts a diverse ecosystem of over 700 different species of bacteria. These bacteria vary from person to person, but for most people, the bacteria and fungi and viruses and other tiny critters form a symbiotic relationship with us that helps break down food into useful particles. For others, however, the makeup of bacteria is disturbed and dangerous. Teeth and gum-destroying bacteria can dominate and cause big problems like plaque, periodontitis, and tooth decay. Regular brushing and flossing are the main ways to prevent cavities and gum disease, but many people also use mouthwash. Around 2 in 3 Americans use it at least once a week, and about 1 in 3 use it every day. Mouthwash can kill problematic bacteria that cause damage, but it's a blunt, if wet, instrument. Most mouthwash brands contain some kind of antibacterial, alcohol, chlorhexidine, essential oils, or cetylpyridinium chloride. These indiscriminately kill bacteria, both bad and good. Using antibacterial mouthwash is like setting your lawn on fire to fight weeds. The weeds might die, but the grass is going to suffer as well. Also, after burning down your lawn, I'm told, once the damage is done, you've got fertile ground for growing, and the weeds are likely to grow back first. So mouthwash can kill good bacteria and doesn't keep the bad ones away for very long, but that's got to be it, right? Wrong. Mouthwash has been linked, weirdly enough, to increased incidence of high blood pressure. High blood pressure is one of the most common treatable chronic conditions in America. Around half of Americans have blood pressure above 130/80, with men at a higher risk than women. High blood pressure isn't itself a disease, but it's a major risk factor for heart attack and stroke, and one of the few that can be successfully treated. So, how does mouthwash lead to increased blood pressure? The answer, even weirder, is laughing gas. Laughing gas, properly known as nitrous oxide and abbreviated NO, helps regulate cell and tissue function. Cells make nitrous oxide to help neutralize a harmful molecule called superoxide, reduce the effects of other reactive molecules, and to regulate blood pressure. Aha! Nitrous oxide is the critical initiator of a pathway that helps blood vessels relax, and studies have found that low levels of nitrous oxide in the bloodstream can increase blood pressure. Cells produce nitrous oxide, but they need both something to produce it from and a signal to start production. That's where the mouth and mouthwash play a role. Some of the chemicals digested by good bacteria in the mouth are nitrates, made of nitrogen and oxygen atoms. Nitrates are found in things like bacon and preservatives, and oral bacteria break them down into either nitrite or ammonium. Nitrite is a precursor to nitrous oxide and acts as a signal for cells to produce nitrous oxide. Ammonium, on the other hand, is a waste product and is a significant ingredient in urine. The major problem with mouthwash, then, is that in an effort to improve our oral health, we may be killing the good bacteria in our mouths that help break down nitrates, produce nitrites, and help blood vessels relax, leading to high blood pressure. Those who use mouthwash twice a day, every day, face a more than 100% increased risk of developing high blood pressure than those who do not use mouthwash at all. So, what should we do? Ignore our dentists? Well, judging by the number of people who regularly floss, the answer to that appears to be a resounding yes, but that's probably not the healthiest option. In fact, the solution is exactly the opposite. The physical removal of plaques by a dentist or oral hygienist, along with regular flossing and brushing, remains the gold standard of tooth care. Talking to your hygienist, dentist, and primary care physician is a great way to learn if this is even an issue for you at all. Many people just use mouthwash because it feels clean, not to fight any kind of mouth disease. There may also be alternative solutions that you can discuss with your dentist, including prebiotics, probiotics, postbiotics, and personalized oral hygiene strategies. With more research, we may be able to have fresh breath without the heartbreak or heart attack. Thanks for joining us on this week's episode of MedEvidence Articles. If you'd like to know more, all of our descriptions are linked in the podcast description below. You can also visit our website at medevidence.com. MedEvidence helps answer the question of who can you trust for medical information. The MedEvidence platform provides valuable information about many medical issues and the insights of evidence-based medicine. MedEvidence educates audiences through engaging and entertaining magazines, podcasts, videos, articles, and presentations. We strive to bring together diverse voices of top-level medical professionals, researchers, and experts to provide unique and engaging content that uncovers the truth behind the data. For more great content, including discussions by physicians and subject matter experts, check out the MedEvidence podcast. My name is Benton, and we'll see you next week.